Good afternoon, and thank you all for being here today. I want to appreciate and thank Dr. Ween with Tampa General Hospital, along with Melissa Snively, Stacy Hahn, and Steve Kona from the school board, as well as Aaron and Jared Nesmith from Sarasota in joining us for this very important announcement in legislation for our children. I'm a mother of 5, and I have children in both elementary school, middle school, high school, and we've seen the headlines recently about vaping. Smoking, and now vaping in young people, is an issue that's both alarming and an urgent healthcare crisis. Precious lives are at stake, and the clock is ticking. Sadly, we are seeing headlines about this on a daily basis, about the vaping epidemic. The latest headline read that the 6th person has died from a vaping-related lung illness. Vaping deaths have been reported around the country, and it's only a matter of time before it hits Tampa Bay. Today, I'm filing a bill to raise the legal age to purchase vaping and tobacco products to 21. My legislation also bans the use of flavoring in vaping products so they can no longer target our children. This is about saving lives. Plain and simple, it's about protecting our children. 1 in 4 Florida high school students report using e-cigarettes in 2018. That's a 58% increase from the previous year. The evidence is clear that smoking is bad for our kids. More and more, it's apparent that vaping is causing harm to our kids. The American Academy of Pediatrics has recommended the minimum age of purchasing e-cigarettes should also be raised to age 21. I believe there is no debate here. Keeping our children safe is paramount and something we should all support together. Failure to do so will bring tragic consequences. We need to pass this legislation this session to protect our children. I'd like to turn it over to Dr. Ween for some comments.
Thank you. As physicians, we're all deeply concerned about the health effects of e-cigarettes, and specifically and especially their use amongst our young people. Through many efforts over decades, we were able to decrease tobacco use amongst teenagers. Unfortunately, the introduction of nicotine to our children through e-cigarettes reverses much of this hard work. Since 2014, e-cigarettes have become the most commonly used smoking product in the country. According to the CDC, in 2018, 1 in 5 high school students across the country reported using an e-cigarette in the last 30 days, an increase from just 1.5% in 2011. The trend was similarly concerning for middle school students, with 5% reporting use in 2018, up from just 0.6% in 2011. Combined, middle and high school student use rose from 2.1 million to 3.6 million just over 1 year, from 2017 to 2018. While vaping may be perceived as a safer alternative to smoking, it is far from safe. Furthermore, it may be a gateway to future cigarette use. A 2018 National Academy of Medicine report found evidence of e-cigarette use increases the frequency and amount of future cigarette smoking. In fact, just this week, the FDA found that one e-cigarette manufacturer violated FDA regulations by promoting its product as a safer option to smoking. The recent outbreak of severe pulmonary illness with e-cigarette use highlights that there remains much that we do not know about the long-term health effects of these products. In a case series of 53 patients affected with this illness, just recently published in the New England Journal of Medicine, reported a median age of those affected of 19 years old, with nearly 1/3 of the patients being under 18, demonstrating the effect of these products on our young people. Most e-cigarettes contain nicotine, the addictive drug, and other tobacco products, which we know has harmful effects on developing adolescent brains. Vaping may introduce other dangerous chemicals into the lungs as well, including ultrafine particles, heavy metals, and volatile organic compounds. As a physician who sees the harmful effects of smoking and e-cigarettes, I'm very happy to see that there are political and community leaders taking steps to keep our young people healthy and limit their exposure to these harmful products. I'd like to introduce Melissa Snively, who will speak next.
Thank you. Good afternoon. My name is Melissa Snively, and I'm Vice Chair for the Hillsborough County School Board. And we are here with our colleagues, I'm here with my colleagues, to show our support for this legislation, for Representative Toledo taking a brave stand for our students and for the children in our community. We know that this is becoming critical. We hear from parents, we hear from teachers, we hear from other students about the vaping happening in our public school system. We don't have all of the answers, but I can tell you this, as a school board, we can work together and we can support advocacy and we can support public policy that will help turn this around so that it does not become an epidemic here in Tampa Bay. So we'd like to personally thank Representative Toledo for her efforts, and we are fully supporting keeping our students safe, keeping our students healthy. Thank you for coming out today, and now I'd like to introduce Aaron and Ashlyn Nesmith, and they're going to share their story with you.
Good afternoon. Thank you, Representative Toledo, for inviting me to share my family's story today. It's a story that feels very personal, but it's a story that's affecting millions of families across the country. I am concerned about my daughter and the future of my younger children, as well as everyone's children. My 14-year-old, who is now 16, is one of the 3.6 million teenagers swept up in the youth e-cigarette epidemic engineered by the tobacco industries out of pure greed. I know this because I was once a Marlboro smoker. Like lots of others from my generation, I got hooked. The advertising made it look cool. Of course, we were kids and didn't understand the concept of addiction and that it could eventually be deadly. The manufacturers did know all of this and misrepresented these facts in order to induce my generation of adolescents to smoke and become addicted. Because teenagers are this industry's only source of replacement smokers. So now I know their game, and I'm hoping that we all see them at it again with their new products. They're using this generation of children, and let me repeat that, they're using our children once again to replace the previous generation of smokers who have either died or were able to quit. When I first saw a Juul device in my daughter's backpack her freshman year of high school, I had no idea that it was an e-cigarette. I thought it was a USB drive for a computer, which is exactly what these companies want. Because they are small and sleek, these devices are easy to conceal with little or any notice. Once I had figured out what it was, I truly had no idea what I was dealing with. Ashlyn had no idea that the cool mango liquid she was vaping contained nicotine, a highly addictive drug, which again is exactly what they want. She promised she would quit, and I know in her heart she truly wanted to, as we have a great relationship, but the nicotine addiction had other plans, and it was too late to stop her. In a matter of weeks, her life was crumbling in every single way. She quit softball, which is something she's loved since the age of 5. Her grades dropped as she started seeking classes to vape with her friends at school. And at home, the mood swings were vicious, not just in a moody teenager way either. Eventually, her addiction led to uncontrollable seizures that forced us to withdraw her from school, fly to Cleveland, Ohio to see one of the top neurologists in the country for possible brain surgery, as she was having 10 to 15 seizures a day and no medication could stop them. As parents, we teach our children to say no to drugs, alcohol, and smoking, but who knew the worst drug was hiding in plain sight? Nicotine addiction is one of the hardest addictions to beat, and Ashlyn is repeating her sophomore year, but at home because she would still be surrounded by her other nicotine-addicted peers at school. Our story doesn't have a happy ending just yet, as Ashlyn relapsed a few months back and landed herself back in the hospital, but this time with 60 seizures a day. After a lockdown on Ashlyn, I am happy to say We are going on 6 weeks of being seizure-free. We certainly won't let Juul be the defining chapter. It must be stopped, not just for my children, but for everyone's children. This is why we have filed a federal class action lawsuit against Juul, Philip Morris to stop them from addicting another generation of kids. We still have a long way to go, and we're just one family among millions to figure out what to do next. But this is why I'm here today to support Representative Toledo's effort against the e-cigarette epidemic. My family and countless families across America thank you for giving this crisis the attention and resources it deserves. Thank you for having us.
I'd like to open it up for questions. If anyone has any questions for me or any of the speakers.
Why is it important to expand on the laws already on the books from 18 to 21? What kind of difference do you see this making?
I read alarming statistics that said 95% of adult smokers started before the age of 21. So if we can just reduce the number of people that are addicted, that are our children, then we will reduce the cost of health care that we're providing. Right now it's costing our healthcare system $4 billion in just people that are on Medicaid and Medicare for smoking-related treatment. So that would be a huge savings to our state. In addition, we have about 160,000 18-year-olds in our high schools. So just the access alone, by cutting off 18-year-olds, your peers that are in high schools with you, that are helping you get these products, I think that will go a long way as well. Any other questions?
I have one for the physician or doctor.
Yes.
How often are you guys seeing illnesses sleep associated with the use of e-cigarettes?
So I think it's at the moment a somewhat difficult question to answer. We don't know what all the long-term effects are. I think some of the things we have seen have been related to some very, very young patients getting into the liquid themselves and having significant overdoses from them. Obviously, in the setting of this new pulmonary illness, we expect to perhaps see some more, but I think some of the other associations are a little bit challenging to characterize because it is a relatively new product in spite of its widespread use, so we don't know what all the effects are yet.
Before e-cigarettes became this popular, it seemed to a lot of us that tobacco use among younger people was on the decline, thanks to all the anti-smoking things that were put into effect, cigarettes banned from bars, etc. Have you yourself at the hospital or people that you've treated, have you noticed the upswing yourself? Did you notice a decline and an upswing?
I think we're clearly seeing more people who, when we speak to them, are talking about using e-cigarettes as a product, in my experience. But you're absolutely right, the statistics bear that out. There was a very, very, as I said, strong decrease in smoking, in cigarette smoking amongst adolescents, and that has clearly been reversed.
How frustrating is that, from a physician's point of view, to see these efforts be effective and then almost canceled out?
Extremely. I think it was a lot, as I said, it was a lot of hard work, not just from physicians, but from the public health community, from community leaders across the board, to decrease and kind of get the message out and have people understand that cigarettes are dangerous and to avoid them. And unfortunately, there's a perception that e-cigarettes are a safer alternative, and they're clearly not safe. And so to have new people start using them and then to have deleterious health effects is, extremely frustrating.
You hear from a lot of adults who use e-cigarettes that they use to try to cut, to quit smoking or something along those lines. What do you think about that? Or do the risks outweigh the rewards here?
So I think we don't know exactly, and one of the pieces I'm so happy to hear in this legislation is the banning of the flavors. It is a different conversation certainly to have with a current smoker to say, hey, this is your path towards quitting smoking. You're going to plan on use e-cigarettes for a little while and then use other nicotine replacements, which we know are safer, gum, patches, etc. That's one thing, but clearly that's not what's happening here. What's happening is that this is an opportunity for younger people to become addicted to nicotine and then move on to smoking cigarettes, likely.
What's the appeal? It seems self-explanatory, but the flavor aspect of this, what's the appeal to kids?
I mean, you see flavors like cotton candy or bubble gum. I don't know what else to say, except I think it's pretty self-evident that, a current smoker doesn't really want to smoke bubble gum. They want to smoke a cigarette, and a kid probably likes bubble gum and cotton candy. I mean, I have a 5-year-old, they'll do anything that's bubble gum flavor. I mean, that's how I get them to brush their teeth, too.
Any other questions?
I'm just going to make a final comment.
Oh, sure.
I want to thank the Nesmith family for their courage to come and speak today. And we get several calls from very frustrated parents that really don't know the dangers of vaping. And you've seen one person, but there are many that don't want to come out and speak, but they are out there, and unfortunately we're going to see them come out in the media. And thank you for being here, because but for you, people would not know that there's dangers in vaping. A lot of parents think that it's just vapors, so we really need to make sure that we're educating not just our children, but the parents as well. So thank you for being out here today, and we can all be here for questions afterwards if you need. Thank you.